This is Dr. Phillip Whitlow, an optometrist at the Kickapoo Tribal Health Center, and we want to talk to you about diabetes and the importance of eye exams when you have diabetes. In diabetes, your blood sugars in the blood go up. When the blood sugars are high, it causes swelling, and then the swelling is inside the vessels of the eye, in which causes the blood flow to slow down. Yet inside the eye, the oxygen needed is second only to the brain in what its needs are as far as to keep it healthy. So in diabetic retinopathy, the blood supply to the eye is diminished, and the eye's demand for oxygen is high. So we get neovascularization, which are new blood vessels, and these blood vessels then will break and leak. And I can show you some of these blood vessels that we have pictures of to give you an idea of what's going on. Here are some large bleeds in the eye, and then here are these little cherry red spots that are just like little cherry red hot candies, okay? And those are the early bleeds, and they are real deep in the retina. The retina is 10 layers deep, and these come from real deep in the retina and come up. And this is one that's come up and spread out. Now, these are old bleeds which have resolved, and just means that this eye has been having diabetic problems for a while. There's a bunch more over here. Location is the biggest thing. How we grade this is there's 4 quadrants. We split the inside of the eye up into 4 quadrants. If these bleeds are in all 4 quadrants, it's considered severe. Moderate is 3, and minor is 2. But we once we see them, we have to get onto it, and we have to figure out how we want to treat it, and where the patient has fallen through the cracks on their treatment. And this is so important because if we can catch this early enough, we can alter the treatment of the diabetes to keep you from going and having failure of the eye. And this is a normal healthy eye with no bleeds in there. And then it's so healthy it has the new car sheen. It has this glistening inside the retina, and it glistens back at you. This is just a really wonderful retina. But you'll look and you will not see any hemorrhages anywhere. Diabetes is a multidisciplinary type of approach to treating diabetics. We need medicine like metformin or glipizide or a range of others. Then we have to do diet and exercise. The medicine will help you a lot, but it will not help you enough if you don't change your diet and do some exercise. You're going to have good days and bad days. That's normal. You're going to have great days and bad days. The idea is to keep your blood sugar A1C around 7, and I like it under 7 myself. At 6.5 or less, we tend to have no problems with diabetic retinopathy or diabetic neuropathy of your feet or fingers. With help from the diabetic educators here, the dietitians, and the health providers, we should be able to make this a much easier disease to control and live happy with it. Again, diet, exercise, and the medicine will help you the most, but you have to stay up on it. You can't say, oh, I'll do it tomorrow. It doesn't work. It's got to be done every day, and you have to be consistent. It is an easily controlled disease, yet a frustratingly hard disease to control. So you're going to have good days, bad days, but overall, if you keep working at it, you'll have more better than you will have bad.